the New Zealand Medical Journal talked about how 50% of all deaths of Māori and Pasifika are potentially avoidable compared to 23% for non-Māori and non-Pacific. So I guess there's a lot to be done in terms of systemic change.
Lots, yeah, and on a policy level, on a hospital management level, but and also in terms of individuals, again, I'm not immune to bias. We all have our own bias, and it's about, I guess it's just a reminder to us all that we can be part of that solution as well.
Yep. We all have a responsibility to train ourselves to use our slow thinking instead of taking those mental shortcuts which lead us to make wrong assumptions about people or situations.
100%, yes.
Yeah. In terms of your specialty that you chose, vascular surgery, I've heard you explain that as being like a plumber for the body. So can you tell us a bit about the surgeries that you perform?
Yeah. So the vascular system of the body is, I think, really fascinating. So basically the heart is the pump, and that pumps blood around the body through blood vessels called arteries, and then once the blood gets to where it needs to get to, it's got to get back to the heart, so it gets back to the heart through veins. So basically I operate on arteries and veins and the various problems that people develop with those. So a lot of the work that I do involves working with blocked arteries or narrowed arteries, and that can be blockages to the blood supply to the brain, so that can cause patients to have strokes. So I do operations to clear out the carotid artery in the neck that takes blood to the brain. I deal with blocked arteries in the legs for patients who have problems with their walking, or pain, or if they develop ulcers or wounds, gangrene, that kind of thing. We do procedures to try and restore the blood flow. And sometimes people will develop potentially life-threatening problems with the arteries, where the arteries swell like a balloon. That's something called an aneurysm. And so I do procedures to basically repair those arteries when they get to a size where they're at risk of bursting or rupturing. And then veins, sometimes they don't work, and so we do procedures to close down veins when they don't work properly. So it's a very, as I say, it's a kind of practical specialty, and there's a range of different ways that we treat patients using kind of minimally invasive procedures to sort of more open style surgery. So it's a real different range of skills that I have to use, which I enjoy.
Yeah.